Probably one of the most wide misconceptions that we have is related to the different micronutrients. So many years ago, fats were evil, so it was really our bad enemy. Now carbohydrates are the bad enemies, but we need to get people understand that we need to balance the different micronutrients. So we need fats, we need proteins, we need carbohydrates, but in a good combination according to the different individual needs. And we need to provide this information to consumers.
It is so easy to find information on the internet, and we see that most of this information are not from solid scientific background. So it is very important for us scientists to reach consumers and be able to connect with them and communicate with consumers about what is good for you and what is not.
I think there's a lot of misconceptions in terms of between health and food. There's some people that don't associate it at all. You know, if they've got a problem with their health, they'll go to the doctor and they'll want a prescription. Quite often, especially with non-communicable diseases, they don't see that actually their diet can influence them. It's diet that has usually contributed significantly to that condition, whether it's diabetes, coronary heart disease, whatever. And actually, food plays a very important part in terms of prevention and maybe turning it around.
I think for consumers it can be very difficult to understand what it is that they would need to do in order to maintain their health for as long as possible, because there are so many different expert opinions, people that are shouting certain things, claiming certain things. So there's a role for the industry to play to try to simplify stuff a little bit more and make sure that there are obviously many different things that you could do, but prioritize those things. Like, okay, the most important thing that you can do yourself is make sure you continue to exercise, make sure your protein intake is sufficient, and then like along that list of priorities go down to things that have an impact but a smaller impact.
Healthy and indulgence can go hand in hand, so there can be pleasure in healthy foods. So it doesn't have to be the idea that healthy foods are less tasty or maybe too expensive. We all have, as food producers, products, ingredients where we feel that we can create products that are tasty, that are indulgible, that are joyful, and you really have the sensory pleasure still of eating a food product. So I think that is also a misconception that it still exists, and that we as food producers, together with policymakers, together with academia, need to make sure that we simplify that message and we make people understand that indulgence and healthy really can go hand in hand.